Medicare Part D is an important aspect that you want to make sure that you're aware of, that you understand, and that you have in place. Medicare Part D is what's referred to as prescription drug coverage. Now there's two main areas that you can get your Part D plan, and it's important that you do so, as we'll discuss later. So first, one of the ways that you can get your Part D or your prescription drug coverage is through an MAPD. Also it's known as a Medicare Advantage prescription drug plan. Now, if it's called an MAPD, that means that the Part D, that latter portion of the name there, is included in that product. You want to make sure when you're looking that you don't just get what's called an MA, or a Medicare Advantage, because that does not include the Part D. And with those plans, you are not able to get a standalone prescription drug plan. So make sure when you're looking that it's an MAPD, so that way it includes the Part D in the plan. That way your prescriptions are covered and that you avoid that Part D penalty that we'll discuss later. Now the other side is what's called a Part D. This is solely a standalone prescription drug plan. It is not part of a Medicare Advantage plan, and it's usually sold through private insurance companies that offer these plans and products. Now you'll want to get this because Medicare alone does not have prescription drug coverage. And if you get a supplement plan, you want to make sure that you're also covered with your prescriptions, as those supplement plans, whether G or N and so forth, do not have Part D built into it. Now the Part D is a stand-alone product, meaning it does not involve any other aspects. You want to be aware of this because this will allow you to get your prescription coverage. Multiple companies and carriers offer prescription coverage, and then inside each one of those companies is various plans. You'll want to make sure that you choose a plan that covers your current prescriptions at the lowest rate possible, as each one can cover them a little differently. So just to recap, if you're going to go on the Medicare Advantage side, make sure that it's an MAPD, or Medicare Advantage prescription drug plan. If you're going to go with just basic Medicare or with a supplement product like G or N, you'll want to make sure that you get a standalone prescription drug plan. That way you avoid the Part D penalty. So what is that Part D penalty? Well, let's cover that next. So a Part D penalty is for individuals that did not get a prescription drug coverage plan and they did not have prescription drug coverage through their employer that was as good or better than the Medicare coverage. Now how that works is when you initially enroll for Medicare, you have what's called the IEP, or your initial enrollment period. This is a 7-month window that allows you to sign up for this prescription drug coverage. 3 months before the month you turn 65, the month of, and then 3 months following that time frame. So it's 7 months that you can either A, get a Medicare Advantage prescription drug plan, or sign up for a Part D plan. So when does that penalty kick in for not having prescription drug coverage? Well, that is 63 days after your IEP. So you get a little more wiggle room to sign up for it. After that, it becomes a 1% penalty per month that you do not have prescription coverage. So this is something that can start to stack, and it's with you for your whole duration that you're on Medicare. So that's why it's important that you make sure that whatever plan or product you choose has that Part D built into it, so as to avoid that penalty. Now, if you're not going on full Medicare yet, when you turn 65, there's something else that's available for you. Now, you'll want to make sure that if you're either A, paying for your own health insurance that maybe your spouse is on, that you want to wait until they're ready to turn 65, or B, you have qualifying employer coverage that has prescription coverage built in, then it wouldn't make sense to pay additional amount for the Part Ds. So rather what you do is you only sign up for Medicare Part A, and you do what's called deferring Part B. So you will not have that Part B penalty because you have qualifying coverage, whether it's on your own or through your employer. Now, one last note that's worth touching on is that the Medicare Advantage plans with prescription drugs built in often can be found for $0 per month. Now, that does not mean it's the better deal. However, you do not have to pay an additional amount for it. On the Part D side, however, there is a monthly premium that is associated with that product. Now, they can range anywhere from around $7 a month or so, give or take as an example, all the way up close to $100 per month. So that's why it's really important that you take a look at your prescriptions to see which plan is going to cover them at the lowest rate. Just because you're paying less for your monthly premium does not mean that you will pay less for your prescriptions when you tie the two together. So it's worth investigating to make sure the plan that you choose best fits your circumstances and needs. So just to recap, Part D on Medicare is what's referred to as your prescription drug coverage. It usually comes in two forms, whether on a Medicare Advantage prescription drug plan or as a standalone product for your Part D. The Part D could have a monthly premium, whereas the Medicare Advantage side often does not. However, that does not mean it's the best option. You'll want to make sure that you sign up for your Part D during your initial enrollment period as to avoid that monthly penalty of 1% that can continue to stack. If you are not going on full Medicare, make sure that your employer coverage is credible so as to also avoid that Part D penalty. And then when you're ready to go on Medicare, it'll be as if you had just turned 65 and you will not have to worry about that penalty.